We're going to get started shortly here. Just going to give another maybe half a minute for folks to join. All right, I think I'm going to go ahead and get started. Welcome, everyone. Happy to have you here at today's webinar, The Value of Health Education Specialists Exploring Career Options Within the Profession. My name is Jessica Wessner, and on behalf of the National Commission for Health Education Credentialing, I want to thank you all for joining us today as part of our celebration of National Health Education Week. So each year, NHEW highlights the incredible contributions of health education specialists and promotes a better understanding of how our work improves population health and quality of life as a whole. So today's webinar is going to continue that mission by exploring how certified health education specialists and master certified health education specialists are making a difference across multiple sectors. Before we get in, I'm just going to go over a few quick housekeeping notes. The webinar will last about 90 minutes, and it includes a roundtable discussion at the end where panelists will respond to your questions kind of in real time. You're welcome to submit questions in the Q&A box at any time during the webinar, but if you have a question for a specific panelist, please make sure you include their name with your question. CHES and MCHES credential holders who participate in the full session will receive 1.5 Category 1 continuing education credits, which will be awarded on or about January 15th, 2026, which is the end of the quarterly reporting period. Keep an eye out. After the presentation, possibly tomorrow, you'll receive an evaluation survey. It'll be emailed to you following the session, and please complete that survey. You need to complete that in order to receive your credit. A few learning objectives. So by the end of today's session, participants will be able to identify a variety of settings where health education specialists are employed. You will be able to describe how health education specialists engage in areas of responsibility while practicing within different employment settings. And you'll be able to explain the major responsibilities and the value of health education specialists in improving the health and well-being of populations. So as you listen to our speakers today, try and think about how their stories and their strategies might apply to your own career path or setting, and how you too can advocate for the essential role of health education specialists in creating healthier communities. First, I just want to give a little introduction to our moderator today. Taylor Pantzer is a wellness and student advocacy and services coordinator for the Community Health Center of Southeast Kansas. And Taylor has also served on NCHEC's marketing committee for many years. She received her MPH from Montclair State University and has held her CHES for 6 years. She's been working for a federally qualified health center in Kansas for the last 4.5 years and is really passionate about sexual and reproductive health. Fun fact about Taylor, which I didn't even know, she has a therapy dog named Scout that loves working with the college students on Pittsburgh State University campus. So now I'm going to turn it over to Taylor to get things started and introduce today's panelists.
Thanks, Jessica. I do have a dog. Her name is Scout. She is here today, so you might hear her. She's a little bit bossy, so sometimes she likes to make a little grumble or whine when she's not getting attention. Hopefully she's not too loud though. So yeah, let's go ahead and get started. Let me introduce our panelists. Who are going to give us a nice perspective of their day in their life of their job roles and their essential skills and tips for working in their respective sector. So first we have Antonio Handy, a health coach and certified health education specialist with Episcopal Health Services in New York. Antonio leads cancer screening initiatives for underserved women over 40, including those who are undocumented and uninsured. His passion for health education began during the COVID-19 pandemic and now drives his commitment to cancer prevention, patient outreach, and collaborative community care. Our next panelist will be Madison Moore, and she is a certified health education specialist. And her role is a wellness specialist at Child Care Associates, a nonprofit serving over 500 employees and families across Tarrant County and Fort Worth, Texas. In her role, she develops and implements wellness initiatives that support physical, mental, and emotional health for staff, children, and their families. Madison collaborates with interdisciplinary teams to provide professional development, coaching, and resources focused on social emotional well-being, burnout prevention, and overall workplace wellness. She's passionate about creating supportive environments. Madison uses her CHES certification to bridge public health principles with practical strategies that foster lasting positive change. We then have Chesley Chapman, and she is the Director of Community Outreach and Engagement, Health Equity DEI at University Hospitals at Seidman Cancer Center in Cleveland, Ohio. With a background from Sam Houston State University and a master's in education from University of Houston, Chesley's interest in health literacy led her to work in patient education at the University of Texas MD Anderson Cancer Center. She has secured funding and partnered with community organizations to address cancer screening inequities among underserved populations in Northeast Ohio, aiming to improve access to care and reduce cancer rates. A former board member of the Cancer Patient Education Network and a current NCHEC board member, Chesley is committed to fostering sustainable partnerships in cancer prevention and education. And our final panelist is Dr. Heidi E. Austin. She is the director of Project Aware at North Carolina Department of Public Instruction, where she leads statewide efforts to promote student mental health through education, screening, and tiered supports. Under her leadership, NC Project Aware has earned multiple national recognitions, including including the School Behavioral Health Champion Award and the Weitzman Institution's Primary Care Impact Award in 2025. A returned Peace Corps volunteer, Teach for America alumna, Dr. Austin holds advanced degrees in health education, educational leadership, is both a certified family life educator and a master certified health education specialist, and brings a vision for schools where every student thrives through inclusive practices and innovative leadership. So that we have an amazing set of panelists, and I'm very excited. So we can go ahead and get started with our very first one, which is Antonio.
Hi, good day, everyone. So my name is Antonio. I work at St. John's Hospital. This is health coach, but I function more as a health education specialist these days. The health coaching role has you have kind of phased that out, but it still says health coach on my badge anyway, on my ID anyway. So we do work. So I focus a lot on community health and chronic disease prevention with cancer screening and diabetes self-management education. And so I'm responsible for health education sessions, community engagement, outreach activities. That's a big one in the community at the moment. So we do last year, I think, or not last year, a few years ago, we started a pantry service where we provide pantry to the community members. So it's done every Wednesday at the hospital. And our other location, we do it every Tuesdays. And also, so I do coordinate so 4 times a year we do workshops for the DSME class and weekly for the cancer screening program. Next slide. Okay, so my areas of responsibilities is engaging community members, identifying barriers to care. So I live and work in the Far Rockaway community. So there's a lot of barriers to care, whether it be persons who are undocumented, they don't, or they're uninsured. So we do work with them in our outreach efforts. So we let them know that, St. John's, our hospital is the only hospital on the peninsula too. So I do work with them in an effort to get them to come to the hospital to get their services done. In terms of planning too, same with the cancer screening program and the DSME program, like I said earlier. So we do create, so we do have special days that they come in to see the doctors. So we created special days for the CSP program, so the wait time is going to be reduced. So if they go to the regular GYN clinic, it's a longer wait. So we have 5 or 6 patients that comes in between Thursday and Friday, and the wait time is much better. In terms of workshop too, so we do a lot of workshops. So I recently I've been doing workshops on Sunday. We had the breast cancer screening. We had a breast cancer event on the boardwalk. So we did some workshops there. We had someone from hematology and oncology. They were teaching ladies in the community how to do a breast exam. So they had a little model, and they were asking to find the lump, if they can find the lump in the breast, and how many they were able to find. And in the community too, we do encourage a lot of women too to come in and get these services done. Next slide. Uh, Listen, the biggest thing about working in public health, I will say, is being adaptable. Like, stuff changes. Where I work, thanks to COVID, well, due to COVID, was it? A lot of stuff changed. So I was doing health coaching, and due to COVID, I wasn't allowed to meet with patients anymore. And my whole role, it was a whole different role, even though, and the problem where I work, my job is a union position. So you're really not supposed to change the roles like that, but COVID, made an exception for that. Um, and also skills. So we need to constantly be evolving too. It's important that we are willing to change, to learn new skills. So I did my master's is in epidemiology and biostats, which is like a far cry away from health education, but I still do like research. And so this is something that I would like to introduce into as a health educator. Community relationships is a big one too in the Far Rockaway community where I work. So there's different CBOs. So we build and maintain a relationship with the police department, the fire department, these different organizations. So we can partner with them during the summer or during the winter, where we provide we'll do like code drives. We'll provide also the police department. There's like NYPD Night Against Crime. It's a big event in the city. All the boroughs, they do it. Um, Growth opportunities are important too. A lot of times we need to come out of our comfort zone. That is one thing I do believe. When I got this job here, I didn't speak any Spanish, so I had to learn Spanish actually to make my position a lot better. So I forced myself into it. I did immerse myself. So I think in terms of, so that is something we have to do, always looking for growth, and also to build our own set of skills that, that it wouldn't be the point we can do anything. So we can be able to understand the data, reproduce the data, whatever is required of us. Next slide. Communicate. So skills for success. Communication is one of the biggest thing in different communities, because there's different religion, there's different cultures. So I also go back to the Far Rockaway community. There's a big Hispanic population here, so a lot of the ladies, I'll call them, to get screened, and they always preferred, in the beginning when I started, they had to make sure that it was a female doctor, because a lot of them preferred the female doctor over male. They like, Stacy, is Stacy female? I'm like, yes, Stacy's female. I was like, okay, and they'll show, and even to this day, once I call them every year to come back for the screening, they always ask, is it still Stacy? Just to ensure that the doctor hasn't changed. In terms of, so we also got organizing, coordinating, and delivering evidence-based program is essential to achieving measurable health outcomes. It's good. So once we working on our programs, we got to ensure that our data is organized, that we can find it, that we can use this data to represent, say, okay, this is the population that we're working with. This is our outcomes. Like for my program, for the CSP program, cancer screening program, I do keep data. So like I can go, I keep it by zip codes. So I'm like, this is the zip codes we get most of our patients from. This is the outcomes that from this zip code, this is what happened, how many patients were actually diagnosed with cancer. So we do keep an idea of everything. And the tips to stay current. In the current public health field, there's so much going on at the moment. Is a lot. So you have to stay current. You got to ensure that we are also delivering, for me, correct information, because there's a lot of misinformation out there on Facebook. So my mother-in-law, I always use her. So she's always big on telling me stuff, and I'm like, no, this is not. So I always have to explain to her. So that is something and a lot of times people don't want, data and stuff. They don't want it. You just need to explain to them, provide education in such a way, like your health coaching, some motivational interviewing, so that they'll understand that this isn't the correct way, or this is what it actually says. Documentation is important. Keep documenting your work. So you have done all of this. So that is something I learned when I got this job here. So document everything that you do, so that if they ask, you can produce it. So you always show that your position is valid wherever you work. I think. Thank you. Yeah, so that's it. If any questions, also, like I said, in public health, one thing, just ensure you stay current. Also, you know what the literature says, continue to read the research. And there's a lot of research keep coming out daily. The science is changing. Is important. One thing with when the science change, that we also change with, we understand what is saying, not just the top surface of information, but we do deliver correct information to our communities. Thank you.
Awesome. Thank you so much, Antonio. Next up, Madison is going to talk about her role.
Hello, everyone. Thank you so much for having me. I'm really excited to talk about my role. So currently I am the wellness specialist at Childcare Associates. My job specifically is worksite wellness, employee engagement, employee experience. But our organization is a Head Start organization. So we're a federally funded nonprofit, and we serve the families of Tarrant County, which is the county I'm in. I know there was some people who were from North Fort Worth or North Texas. So y'all might have seen our studios around. We have 16 16 studios across the county, and then we also service the counties that are around our county with the subsidized childcare, because y'all probably know how expensive childcare is now. So it's just our way to give back to the parents of the community so they can go to work or they can continue their education and not have to worry about childcare if they don't have like immediate family to take care of them. But a little bit about me, I did see some yeehaw and giggums in the chat, but I went to Texas A&M for my undergrad and my master's, and I love Reveille. She's the best mascot and the best dog in the whole world. She just recently had her, she had surgery and she had her eye removed, so I wanted to include her with the eye patch. She's so cute. I love her. But I graduated with my master's in December 2022, and then I took my CHES certification in the spring of 2023. So I was really confused what I was doing with my life. So I just kind of was like, let me graduate, let me figure out what's going on with life. And then I focused on the test, and I think I took that in April. And it's been a great experience so far for me. But you can go to the next slide. So a little bit more about Childcare Associates is we kind of have two buckets. We have our main umbrella, which is childcare, accessible childcare in the community. Like I said, we have 14 sites, and we have a couple partnerships with the ISDs in our county. So we deliver comprehensive services. So it's not just you drop your child off at school and they just sit and play all day. Like, they're learning, they're getting social, emotional experiences with their teachers and with the staff and with other kids. They're learning about relationships. They're learning healthy food. We do family style dining. So they're learning how to give and receive care. They're learning what are vegetables. They might not see those at home because they are low income families that are on government assistance. So they may not see most of this food. We do provide them 2/3 of their daily nutrition values. So we give them breakfast, lunch, and a snack. And then of course they have a 2-hour nap time, which I'm so jealous of. But then we also have our innovation side. So we have the direct services, direct care. And then we also have the innovation, that's nationwide. Our CEO is in Washington, D.C., or she's in Austin every other week. She's advocating for childcare, for more funding, for more policies that benefit our childcare centers nationwide, partnerships with community organizations, and just benefiting the salaries of our employees. We just recently got a little bit of an increase in funding, so we were able to bump up all of our minimum wage from $11 an hour to $15 an hour. So that's the base salary that everyone is getting whenever they come in to work at CCA. And then our bachelor degrees, and those candidates, they're making comparable to what the ISD kindergarten teachers are. So around $60,000, which was like a 70% increase from the past 2 years. So that's all thanks to our innovation team and their partnerships with the government and Board of Education, everything like that. But you can go to the next slide. And then a little bit of how we do that is we also have 2 entities that are underneath childcare associates, and they work on the quality care. So some of y'all might know people who run childcare centers out of their home, or they work at like a children's courtyard, things like that. Some of the like private practice and private income, but they are all working to be like Texas Star, nationally recognized, state recognized, so they get money from the government to serve this next generation of kids. So we work with them to coach them and get their skills and make sure they have all of, like, they're gonna pass health inspections. If someone comes in from licensing, they're gonna pass that. So we work with literally every single childcare center that you can imagine in our county, as well as just outreach. We do a bunch of outreach events. I do those to because I work in HR now, so I will be on like the employee side. I'm like, I know you want to work here, it's great. But then also attracting the parents who are like, oh, I've never heard about CCA. I have kids under 5. Let me enroll my child. And then also just getting parents involved. We do a lot of parent talks and how CCA has impacted their life. We just had a luncheon yesterday, and that was our big moneymaker event. We had parents come and talk about how they were themselves kids in Head Start, and then now they have parents, their parents that either work there or they have their kids in Head Start. So it's just great, like the full circle. We just want everyone to know what resources are available to them, and the partnerships that we have for housing, for continuing education, clothing drives, all of that. And you can go to the next one. And then these are our little kids. Everyone loves the kiddos. I took this picture on the left of the kid in the little tunnel. They're just amazing. Those kids are so cute. They are ruthless though. They have no filters. So you will go in and they will say whatever they want to you. And I'm like, that's great. I have been humbled today. You can go to the next one. So a little bit about what I do at CCA. We have a wellness committee, and I'm the chairman of the wellness committee. We do Wellness Wednesdays every single week. Part of our issue is the communication, which I'll kind of talk about that later, but some of our staff are sitting at desk all day. They're on the phone. Some of our staff are teachers. They're hanging out with the kids and getting them ready for lunch. So they don't really have time to look at their emails and any communication that I might be sending. Like, this is Breast Cancer Awareness Month. So each Wednesday I've been kind of giving them habits and what you can do, because the majority of our work population is female, but of course breast cancer does affect males as well. So targeting and tailoring information for our staff so they can get that information. And then I do different initiatives kind of every month. I like to have a theme for the month. And then my boss will do Meaningful Mondays, and then I do Wellness Wednesdays. So hers is more like let's get you in the mindset for work this week. And then mine is more action oriented. So have you scheduled a mammogram this week? Or if we did a bingo for self-care September, and so that was just something they could do on their own time. It wasn't something they had to log in to watch a meeting. And then I also do professional development for our staff. We have quarterly PD days, which I'm sure all of y'all know how lovely they are. So I come in and I kind of do like the more fun, interactive activities. I like to talk about the 8 areas of wellness, just because when you say wellness, a lot of people just assume you mean physical wellness, the absence of disease, and mental health, which are like they're big things that I hone in on: getting enough sleep, smoking cessation. But there's so many other things like intellectual wellness. I told them about Wordle. And I have people emailing me every single day and they're like, I got the Wordle in 4, I got the Wordle in 2. And I'm like, way to go, way to get that intellectual wellness in today. And then I do partnerships with community organizations. So we're actually opening up a new studio with a partnership nonprofit, and we're working with them to kind of get excited for this opening in this brand new studio. And we're going to have kind of like a CCA giving month. So it's November and December coming up. We're doing food drives, we're doing toy drives and things like that to get ready and kind of explain to people how like giving and volunteering and acts of service are a great way to boost your emotional health. And then everyone has the more duties as assigned line in their job description. So a couple other things that I do that aren't along the lines of a wellness specialist. I'm the volunteer intern coordinator. So running the paperwork, we have licensing come in like whenever they want. So they'll just be like, hey, where's your background check? And so I just have to make sure everything's on file for them. I'm also a TBRI practitioner. So I work with our vulnerable kids who have just seen so much trauma in their few years that they've lived. They are having a really hard time communicating what their needs are. And that is a trust-based relational intervention. So, sorry, yeah, I always talk about it and then I never explain it, but it's trust-based relational intervention. And that is a partnership through Texas Christian University in Fort Worth. They're the ones that created this. And they have summer camps. It's a lot of kids who are in foster care, and they've struggled with having a safe place, feeling comfortable, not knowing how to have that relationship with a teacher or a foster parent. And our kids are little, some of them cannot speak. And it's mainly just about making that connection that this is a safe place. I am a safe person. You can come to me if you need anything, and building that connection so that they aren't as likely to hit a teacher or to hit a kid or just to have these meltdowns, which they always do. We have the toddlers and they're going to have some meltdowns every now and then, but just making sure that our teachers understand what their triggers are so that when the kid starts hitting, they're not going to hit back. They know how to breathe, deep breathe. They know how to regulate themselves, so then they can practice co-regulation and modeling with our kids. Also, I feel like every health education specialist has a little bit of content creation in them. We're always creating flyers, we're always creating educational materials, and like I said before, just tailoring it to our audience. Grant writing, we just received a $1 million grant for our nutrition department. Yeah, I did that. That was crazy. We had 3 days. And so we got $1 million, and that's going to go to hydration. Some of our studios are a little bit on the older side and they don't have the best water, the best tasting water. So we're trying to have just accessible water for our kids. So if they can't communicate that I'm thirsty, which hydration and food is a great physiological regulation tool. So drinking a sip of water can kind of help the kids calm down. And then procurement, I'm sure everyone in the nonprofit field is familiar with procurement and what can and cannot be used. That's always fun. Traveling. And then also I work with our benefits team. So anyone who emails and they're like, hey, like I'm looking for mental health services or things like that, just making sure I know what people have that's available to them for free and what their benefits and their insurance covers. And then I'm also a chairman of the Together We Lead committee, which was ideally our DEI committee. However, we had to switch real quick and to keep funding for that committee. Now it's Together We Lead, and we're working on creating a safe and just connecting community at CCA. And that's freshly new. So that's still kind of in in the ground, but we're working on that to become a more positive role in our community. And we can go to the next one. And then my areas of responsibility, pretty similar to Antonio, definitely area one, assessment of needs and capacity. We have a very finite budget. So what can we do to meet all of these needs that people are reaching out to us? So I go in, I observe the classrooms. What's the burnout level like? Is there enough coverage in this classroom so people can leave and go to the bathroom? Or do we need to throw in an extra employee into that classroom? I do monthly surveys, so that's kind of gauging what's going on in people's lives. Like we said, there's 537 employees and growing. So it's hard to reach out to all of these people, especially since they're all over the county. So that's what we kind of found, that employee experience surveys was the best way to gauge what's going on in their lives, personal and professional. Obviously, I want to know what's going on at home, like if you need help there. And then planning, like getting organization-wide events. We have an annual all-staff event. We did massage chairs this year. They loved that. But getting all of that funding together, kind of getting what was the feedback from last year? What do they want? How can we make this interesting and not just a boring professional development day? And then implementation, getting that information from my surveys and making sure I'm closing that feedback loop. That's fine if everyone's filling out these surveys, but if they're not seeing any of their needs getting met, any changes occurring, then what's the point of having the survey? So I always try to close that feedback loop. And then finally, like I said before, advocating for early childcare, advocating for our early education parents and the staff who are going every single day to work and teaching this next generation of doctors and actors and whoever these kids want to be, just making sure that our teachers have what they need to give back to these kiddos. And you can go to the next one. I think I might have one more. Yeah. So my key skills for success, adaptability. I came in and I've had 3 different job descriptions. I'm about to celebrate my 2 years. So just kind of like understanding what the company needs. And you're the expert in your field. So making sure that your feedback is heard and just being flexible. Honestly, it's changed my life. I had a job description. I was like, this is what I'm going to do. And then I had another one. I was like, okay, this is what I do now. And then now I'm on my 3rd one. So, and then communication, content creation, tailoring it for your audience, making sure like the reading level is, we have some who are bilingual, some who don't speak English very well, making sure that there's pictures and things that are going to attract everyone's attention. Collaboration with all the departments. I work really closely with nutrition just because it's so closely aligned with the wellness of our kids, making sure their needs are met. And then mental health and disabilities department, working with our education department and partnering with HR and all these other child services roles to make sure that everyone knows what's going on. We don't ever want to be out of the loop, especially from the HR lens. And then authenticity and confidence. When I first started, it was my big girl job, and I was very nervous because everyone had been in this field forever and they were very seasoned and they were experts, they were pros, and I was the only public health education specialist. I was the only person that had a CHES specialist certification. So just being confident in yourself. I definitely consider myself a personality hire. If y'all are familiar with what that is, I think they just looked at me and they're like, yeah, we need something like her in to kind of boost everything up. Like no one was doing bingo before, so love doing bingo. And then we always have prizes, of course, because everyone loves an incentive. But just making sure that people are happy in their role and making sure everything at home is all right. I like being the little confidant, and then just a peer mentor is always great. But yeah, like I said at the end, you are the expert. So just being confident in your skills and making sure your opinions and values are heard. But I think that's it for me. Thank you so much. Oh, never mind. I have one more, sorry. But honestly, we can skip the career advice because I went over all of that, but I did want to show, these are kind of things that I've done very small things. This is my burnout prevention bingo. So you could do it anytime you wanted to. You just had to send me a picture once you completed a bingo of one of the activities. And then we have our brag box, because everyone's always doing so much. They're always giving more than what's expected of them. And this was a way to kind of shout out those people. We have the anonymous brag box who submit. Hannah Snyder, I actually submitted that one. She broke her arm and she was in our food pantry restocking, lifting pounds and pounds of onions and tomatoes. And she provided a great experience to our families who rely on that food pantry. And then the last picture is we partnered with TCU Kappa, and their philanthropy is CASA. So they are advocates of kids who are in foster care, and they did a 5K, and that's all of our, not all of our, but all of my friends and everyone who wanted to come run a 5K with me. And our future CCA employee and our dog. But I think that was it.
Awesome. Thank you so much, Madison. We really appreciate it. So our next panelist will be Chesley.
Hi, and thank you so much. Again, my name is Chesley Cheatham, and I'm the Director of Outreach and Engagement for Seidman Cancer Center in Cleveland, Ohio. So I'm looking at the chat, and I'm seeing some folks that I know. So, shout out to my colleagues down in Houston, Texas, and some of our colleagues in other parts of the country. So good to see you, at least virtually. A huge thank you to the digital organizers of this meeting, InCheck, and also to my fellow panelists. So I'm just going to chat a little bit about what I do here at the Cancer Center and how I interact with other health educators, how I hire them, what I look for in candidates, and then happy to answer questions. And I see some folks are asking questions specifically to the panelists, so please do that, and we can be more specific as we do that. But just a little bit about sort of what my purview is at the Cancer Center. So I'm responsible, and I don't know if the PowerPoint will do it like one thing at a time. So if we go to the next slide, I'll continue there. But essentially, I'm responsible for the design. Yep, we'll do that. We'll just keep it there. Yep, the design, the development, the implementation, the evaluation of health education programs in a cancer center. So everything that I'm talking about is going to have the lens of oncology. And Seidman Cancer Center is a comprehensive cancer center, which means that we are entrenched in education and training, obviously direct patient care, and clinical trials and research. And there are over 45 comprehensive cancer centers across the country, and health education and health promotion is a component of those cancer centers. So there are a lot of people that do what I do at other cancer centers, which is really cool. So and so a little bit more about that. So obviously I was thinking about what Antonio talked about in terms of some of the other cancer risk reduction opportunities, prevention, screenings. We do that as well. And so obviously the sector that I'm in is in healthcare. Next slide. Yeah. So just a couple of things I like to, it's pretty, I would say the breadth and the scope of health promotion and health education in the Cancer Center is pretty unique. And so in a lot of ways, we are part of other folks and other entities that do what we do. And so for us, that is the NCI, the Association of Other Cancer Care Centers. The Cancer Center that I work with is actually is part of a consortium called the Case Western Reserve Comprehensive Cancer Center. So it's us at Seidman and also the Cleveland Clinic, and that's, you may have heard of those institutions. But under the purview of what I'm responsible for, and other folks who do what I do in this role at other places, we're responsible for the Community Health Investment Report, or maybe your Community Benefit Report. And so a lot of health educators, health promotion, program managers, health directors do this as well. And so it's unique and certainly a skill set that I got when I got this position, but really helps us to shape and tell the public and obviously our employers what we do and how that benefits the community. And there's a dollar amount associated with that. So it's a part of a community health needs assessment that happens, at least at my institution, every 3 years, and we help to coordinate that as well. My roots are in patient education, so I put that down there, and that's one of the things that we've done, and that's a little guide down there at the bottom right, quick ways that we can help. And that's just a patient-facing document that we have. We have over 1,500 patient-facing documents that help people prepare for their treatment, get through their treatment and post-treatment, and our teams help to write those things. A picture of me doing some education around clinical trials. That's a huge component of what our team does, and just presenting that at a recent conference last year. And then I added this because this is kind of added in the past couple of years, helping to manage our social media, or our sort of patient and our PSAs that are shared with the public. So the text there: my cousin's friend cured cancer with baking soda, and other things that you might read on the internet. Most recently, we have had quite a few people asking about alternative forms of treatment, things like ivermectin. And so my team and other teams that I work with help to put messages that are a little bit more based in evidence and help people sort that out. Next slide. So how does this relate to the training that we have in terms of our areas of responsibility? So the first one is our assessment of need and capacity. And so what does that look like in what I do? That's that CHNA, right? So the community health needs assessment, super, super important, and how we keep our tax status and so on, and community benefit, et cetera, et cetera. And also it's a big part of our accrediting process. So a lot of hospitals have accrediting. It used to be Joint Commission, and for us, it's the NCI and the Commission on Cancer. So we use that CHNA and other processes to be a part of that accreditation. So thinking about that from a health education standpoint, all of those things are super, 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 super important. The things that you might have learned probably in your undergraduate years, they come into play when you get a position like mine or one in a health education specialist. The second, around evaluation and research. Again, at a cancer center, clinical trials, specifically recruitment, super important. What are the barriers that patients face? What messaging in terms of it being culturally competent and in languages that folks can understand? My team helps to develop those types of messaging and test them. So we are in the community asking, like, well, how if you were a patient at a cancer center, how would you like to receive this information? What would it look like? What's the digital footprint? So we impact those conversations as well. And super important, and I think that Antonio brought this up, more specifically around the documentation. And in a lot of ways, at least at a comprehensive cancer center, that means evidence-based practice. What does the literature say about what you do, how you did it? Can you evaluate it? Can it be replicated? And that is something that is hugely, hugely important. And we're happy to say that we contribute to evidence-based practice and literature on an annual basis. So we're happy about that. Leadership and management. That's more so that now that I'm in my role, and that's affecting system policies. So, whether that's advocating for this particular profession or things like putting in policies to affect certification pay for folks who have a CHEST and MCHEST, that's sort of in my wheelhouse, and happy to do that. Affecting budget, creating budgets. I do a lot of writing to sort of supplant any gaps in delivery of health education programming. So that's a lot of what I'm doing, and along with those grants comes reporting. So what did we do? Was it effective? What were the impacts that we had in the community? And so love to do that work. I don't get out as much as I used to in terms of the community. I'm a little on the back end doing some of the paper pushing, but certainly has an impact there. And then again, from communication standpoint, contributing to the literature, whether that's a journal, whether that's an op-ed piece, whether that's something in the newspaper, but making sure that those messages come from a place of cultural humility, and again, affecting that from a social media lens there. Next slide. So now the fun part. And when I thought about this conversation, I knew that a lot of folks would be maybe different areas in their career. So you know what I did? I went to ChatGPT. I sure did. Went to ChatGPT. But likely enough, it pulled up something that was really, really, really interesting. And I thought that it was pretty spot on. So again, just a couple of advice tips for early career health educators. ChatGPT put it into 3 categories: early career, mid-career, and someone like me, 112 years old, sort of late career. But the first thing that was up there was get certified. So I'm so happy to know that ChatGPT had considered, getting your CHESS or your MCHESS to help with your credentialing and certainly open doors there. Again, nothing that hasn't been repeated from Antonio or Madison. Build a diverse work experience, work in multiple settings. Obviously, we talked about schools, nonprofits, clinics, in my case, a hospital. Know your audience. Let me repeat that. Know your audience. A lot of times we come prepared because we have all the things. We have all the things and all the PowerPoints. We do. We are ready, prepared, and that might always not be the way that this audience wants to deliver that. And it's important that you know that when you start working. Sharpen those communication skills. When I look to hire people who do the title here at my hospital, health education specialist, some of that conversation is just how you can communicate with me. Are you clear? Do you understand? Do you take your time? Can you sort of read my delivery and adjust? And that's hugely important. And then public speaking, writing, and digital health tools, hugely, hugely important in this career. Next slide. And again, AI on a roll for the mid-career folks, specialize or diversify. So thinking about policy, grant writing, and program evaluations. I hear a lot more that health education specialists or folks who do what we do contract or consult. I think that's super important. Your data skills matter. How are you collecting, interpreting, and designing your data? Do you have those tools like SPSS, Qualtrics, or any of those things? That's not my sort of forte, but I know how to access people who do know. And if that's the case, then you can connect with folks who do this work. Network strategically. It is so important that you get out there and join professional organizations, whether they're at the local level, at your state level, or if you're able to do so at the national level. I have made so many contacts at national meetings. In fact, I'm sort of pointing at Heidi, who's at the end. We were at a meeting, and same thing with Antonio, and learning what they do and connecting out, off sort of off the screen. And I'm like, oh my God, I didn't know that there was a job like you do. That's what you do for a living. That's great. Yeah, that's amazing. So doing that just opens doors for you and you can help others, you can help others learn as well. And then advocate for your profession. Listen, when they tell you what is your elevator speech in 12 seconds for health education specialists, have it down pat. Sometimes you only have 12 seconds to sort of understand and make people explain or help people learn or understand what it is that we do and how it brings value. So certainly have that on the ready. Or as the kids say, I think they say heads on a swivel. That might be something different, but you know what I mean. So that way. Next slide there. Again, AI taking it home for long-term career planning. If you want to consider careers in leadership and management, think about things like administration or nonprofit leadership. A lot of people think, listen, when I was in college 112 years ago, I just knew I was going to be a health educator for the CDC. I just knew it. That's what all health educators do, and that was my career path. And it wasn't. And so I think we have to be open to understanding what other roles could help us do what we do. Learn how to budget. Most hospital systems have softwares that do the things in terms of budgeting, but if you can understand some of those concepts, maybe look over the shoulder of folks who are doing that, it certainly helps. Again, these are some of the things that weren't necessarily familiar to me. So through learning curves and taking, classes around that, it certainly helped. Staying current. If you're like me, Twitter or X is not enough. That's current for the moment, but thinking about what trends are happening in public health, what trends are happening in health education, and how am I contributing to that? And I think that this is a huge one, to teach or to mentor. If you have benefited from being a mentee or learning under someone, do yourself a favor and everybody else a favor and extend that to someone else who needs it. So, at least once a year for 6 weeks or maybe more, we have students in all areas, sometimes not even in health education, but we want them to get that lens. And again, I'm in oncology, so super important. They too can help you spread the message about health promotion and what you do. So please, if you can, impact that in that way. And again, impacting policy. A lot of us are doing this in a nonprofit scale, but if you have the opportunity to lobby or influence health policy, especially now with cuts and things like that, super, super important. That can help with systems change there. Next slide. Okay, so we talked about AI, and I think that's wonderful, and it was important, but let me just give you Chesley's advice. And so I've been doing this for a while and love to hire folks to do this and train folks. But like we've talked about before from Antonio and Madison, and I'm sure Heidi, being flexible. If you go into this career thinking you are going to do in the box with my 7 things and I'm going to get off at 5 o'clock and I'm going to go home and have a weekend, that might not be this. So it's important that you stay flexible. This is one that probably my staff gets a little angry with me, but say yes before you say no. You don't know what sort of opportunities will be available to you. I can't understand sometimes. I hear people like, well, I don't know, it's on a Saturday. I'm like, girl, being open to being able to meet the needs of your community, especially if that's the setting that you're in. So me personally, I say yes before I say no. I had a boss earlier in my career. I was getting stuck on some grant writing, and she was like, rely on your training, right? So there's nothing that is new under the sun. Everything we're talking about, most things are not new under the sun, but most things you have learned before. It's just really kind of understanding, going back to those textbooks, connecting with your colleagues, but just rely on the things that you've learned. And again, network, show up. And that means sometimes to all the things. When you have a community partner that wants you to come out to a breast cancer talk and there are 6 people there and those 6 people are so engaged, trust me, it makes a difference. It lands and you will endear trust in your community. So certainly do that. Health education is not one size fits all. I don't care what textbooks say. We have to do all the things, and I mean all the things. So make sure you keep that in your pocket. Ask questions. And I know that sometimes when I have students, they are a little timid and may not be comfortable asking questions, but it is how we learn. Nobody knows all the things. So, get comfortable in that space. One that I think is huge, at least now I have to do a lot more, write. So I think sometimes I get folks who are a little afraid and I don't know, I'm not the best writer. You get better. And your perspective is your perspective, and it's new to me and it's helpful to me. So write all the things, as much as you can. And then having a goal in mind. Whenever I talk to students who are about to graduate or recently graduated, I'm like, well, what do you want to do? And they're like, I can do anything. And I'm like, well, do you want to be a flight attendant? Or do you want to be a pharmacist? Like, help me help you. What is your goal in mind? And listen, we may not know what that goal is, but if you're talking to someone who has the ability to hire you, you can be specific. So maybe you don't say, I can do anything. Maybe you frame that with, I'm interested in pharmacy, whatever the role is there. So being a little bit more specific and having a goal, it can also help the hiring person direct you to what resources you might need. I think that might be my last slide, but I am open for questions. I'll put my contact information in the chat. I like hearing from folks. I really do. I'm not one of those that's like, put it in the chat, you never hear from me. I will write back. We will have a conversation. So I'll stop there. I think that's it for me, and then open up for the chat.
Awesome. Thank you so much, Chesley. All right. Next, we have Dr. Heidi E. Austin, and she will talk about her role.
Awesome. Well, Chesley is a tough act to follow, and I'm going to suggest that InCheck have a whole Ask Chesley webinar. I think that would be fantastic. I'm Heidi Austin. I'm with the North Carolina Department of Public Instruction. I became CHES in 2005, and I became MCHES in 2011. And I am also a certified family life educator, which is the CFLE designation. And I noticed someone had asked in the Q&A about other professional kind of development experiences. And I do think that the MCHES and the CFL certifications complement each other. And they combine the MCHES population level health education and evaluation experience with the CFLE's family-centered relational and developmental focus to promote holistic well-being. So I found the two to be very powerful. And so my career in health education has taken me a lot of different places. Over the past 2 decades, I've worked at a local education agency. I started my career in North Carolina as a Teach for America teacher, teaching kindergarten. I've worked in a university setting, managing a health education campaign that was funded by the March of Dimes. It served to get college-age women in the habit of taking a multivitamin with folic acid to prevent neural tube defects. I've worked for Smart Start, which is North Carolina's early childhood programming. I've worked in early intervention. I worked at a local health department, and I have worked at our state division of public health, specifically on projects related to children and youth with special health care needs. And so the past 6+ years, I've worked at our state education agency, the North Carolina Department of Public Instruction, and I have served as the Project Aware Activate Director. And so there's a QR code here on this slide. And if you're interested in learning more about our school behavioral health work in North Carolina, that QR code will take you to the North Carolina Department of Public Instruction website, where you can find a wealth of information about our project, media, and all of our evaluation reports. If we want to go to the next slide, I'll tell you a little bit about the project that I work on. So, AWARE is an acronym for Advancing Wellness and Resiliency in Education. And Project AWARE is a funding opportunity from an entity known as SAMHSA, the Substance Abuse and Mental Health Services Administration. SAMHSA is a branch of the U.S. Department of Health and Human Services, and it's charged with reducing the cost to society for illness, death, and disability related to mental health and substance abuse. And so SAMHSA put out a funding opportunity that state education agencies could competitively apply for. So the North Carolina Department of Public Instruction has applied and received 2 different Project Aware grants. What we are a project to first increase awareness of youth mental health issues. Secondly, provide training to school personnel to detect and respond to youth mental health issues. And then thirdly, and most importantly, to connect youth and their families to needed services. We do this through what is known as a multi-tiered system of support. So we provide core supports to all students pre-K through 12. By core supports, I mean things like social emotional learning, character education, bullying prevention, things that are universal supports, things that promote mental well-being for all students. And then we have students who might need a little bit of extra support. So they get some supplemental supports. They might have a check-in, check-out. They might have some sessions with the school counselor. They might have some group counseling sessions. They just need a little bit more support. They get all the core supports, and then they get a little bit extra support. And then we have some students who need intensive supports, and that could be all the way to crisis response, wraparound services. So we provide tiered structural school behavioral health supports to students. And my job at the state education agency is I am the project director. I oversee $18 million of SAMHSA funding across 2 Project Aware grants. And so you've heard this from my other presenters today about we do federal reporting, grant compliance, budgeting, managing teams on the ground, just all of the back end mechanics that make a lot of these federal grants work. You might have heard a little bit about this federal shutdown that we're currently in. Thankfully, our notice of award showed up. SAMHSA grants that receive their awards are able to operate and draw down funds from the payment management system, but all of our SAMHSA people are furloughed. So always interesting and fun times when you're working on federal grants. If we want to move to the next slide, I'll kind of tell you a little bit more about my responsibilities as they align to the different areas. So I've put them all on here. In terms of Area 1, conduct or oversee needs assessment related to school mental health services, identify gaps in resources and capacity across school districts and communities. In regards to Area 2, develop strategic plans for implementing mental health awareness and trauma-informed practices, and align goals with state and federal priorities for school-based behavioral health. In regards to Area 3, coordinate delivery of mental health programs and trainings in schools, and support implementation across local education agencies. Area 4, monitoring and evaluation. We have to report to our federal funder, SAMHSA, on how we're using these funds. We report every quarter. We use that data to inform decision-making and for continuous quality improvement. Area 5, again, manage $18 million in SAMHSA funding, provide leadership, budgeting, staff coordination, and stakeholder engagement. Area 6, act as a liaison between schools, communities, and mental health agencies, and provide guidance on evidence-based mental health practices. In Area 7, this is the most important one these days, advocate for sustained funding and systemic change for school mental health, and communicate with state and local leaders to build support for mental health initiatives. And also, we've done a lot of work with private foundation funders, getting other entities interested in investing in our work. If we want to move to the next slide. Perfect. In terms of advice, health education is constantly evolving with new research, new policies, new community needs. Stay curious, stay flexible, stay open to new approaches, tools, and partnerships. This mindset keeps your work relevant and your career resilient. For our early professionals, build that professional toolkit. Get involved in grant writing, facilitation, data and storytelling for public health. And for our mid-career professionals, don't be afraid to pivot. The core of what we do, empowering communities, translates across sectors. So whether that's healthcare, policy, tech, we empower communities. Don't be afraid to pivot. And one thing I've learned is that health education is broad. Truly, truly, that is a gift. While finding your passion area matters, remaining open to new environments and populations has helped me grow and discover new strengths I didn't know I had. So systems thinking has helped me stop solving surface level problems and instead ask what's driving this health issue. This shift has led to deeper, more meaningful work. And as for data, raw numbers don't create change, but data paired with stories, that's how you build support and momentum. These skills gave me options, whether I wanted to stay in direct service or move into strategic roles. They translated well. They've helped me grow without leaving the field of health education.
All right. Thank you all so much. I very much appreciate it. And we have a ton of questions that have come in. So again, if you haven't already and you have a question, please throw that in the Q&A box and we'll get that going. But I'm going to go ahead and get started. So Antonio, you had answered a few already, which was awesome. So is Chesley. So I appreciate that. But one for Antonio was, if you wouldn't mind, could you share any like go-to resources or training workshops that you've helped that have helped you stay up to date and impactful in your role?
Oh, one of them that I use, it's I think it's George Washington University. There's a lot of C's there that they're very good. Like for the cancer screenings, they're very good. There's Cancer Foundations. I use that one also. There's I think I shared one. The link in the chat is called Novodisc. So they're good with health education for diabetes. And there's also the ADC, the ADES. They also good with stuff for diabetes. My organization is actually accredited by them. We are in a current audit with them at the moment, which is nerve-wracking, but there's some others. So I use a lot of the state ones for like New York State Department. New York Department of Health. I use a lot of those for my information too for cancer screening.
Awesome. Madison, what skills do you have to learn on the job to be able to perform all your duties? Because in your current position, sounds like you hold a lot of hats. So how do you juggle it all, and what kind of skills have you learned?
I will say, and I know this is not applicable for everyone, but I have the best supervisor manager in the entire world. And I think that's something that I've learned as being like an early, just being early in the field, that's if I ever leave this company, that's something I need to look for. She kind of grounds me. I feel like I always, like, from being fresh out of school, I had great time management because projects, presentations, all of that stuff really, I didn't realize it in the moment, but it really transfers to work life. And just being able, I know Chesley said say yes to everything. Sometimes it's okay to say no as well. And it really depends. That's kind of how I got involved and wear so many hats. And I've kind of learned that I have no more room for the hats in my closet. But just being involved to the amount that is okay with you. Like I was burnt out within like 3 months of working here. And it was just because I was like, everyone's so busy. Like, let me help everyone. And I got to meet so many people, and now they all know me and they know what I'm capable of. But also sometimes I'm the last person that says yes. And that's why a lot of things get passed down to me. Um, but I think also, and I said this so many times in my presentation, but just being able to tailor your information, being a health education specialist, like we have so much knowledge, and like we went through these classes, like we prepared for this test, and we are the experts, but you have to be able to translate that information to your audience in a way that's going to stick with them. So I like to do small, tiny habits that you can do every day to have a more well life, to be more emotionally balanced. Why I love doing the bingos and like just those quick little challenges. So that's something they can do. Like they can read a book every day. They can listen to an audiobook if they don't like reading. Giving them options, things to do. The hats, I literally got an email while we were doing this, and yesterday for the luncheon I bought balloons, and they were like, literally, thank you so much for those balloons. Like you're always willing to say yes. And I'm like, that's something easy I could do. But I love being involved and I love knowing what's going on, and like even just like helping the IT team. Like I am probably like the least informational tech savvy person, but I want to make sure that they're having a good employee experience as well. So I think that might have answered the question. Sorry.
No, you're great. Another question I saw come across, and me being Ches too, I understand this, is did for any of the panelists, did your role exist before you joined your current organization, or was it something that you created or advocated for that specifically highlighted your Ches or Ches?
For me, my role did exist. I think there's this at one time they had this called distrip. So my role is one out of distrip. So I used to work at a community health center, and they had distrip at the hospital. So my role, so once it's finished, the hospital still kept us because we are under the union, so they weren't gonna let us go that easily. But it was there before I got here.
Same for me, and gladly that a chess certification is a requirement of my position. So happy about that. So and my position exists at most cancer centers, so that's nice.
Mine was not. I applied for a position and then they said, we're actually not looking for your area right now, but they were like, there's this other job. It was a new job. And I did my best. That was job description number one, but that was more, and I think someone asked about this in the chat. I did not have a lot of childcare experience. I worked on after school care. But they were older kids. So my first job was more behavioral health inside the classroom, and I just did not have that. And so then I got involved and I said yes to a lot of things. The hats started growing. And that's how I got more involved in HR and employee experience. And then that was my second job description, and they added the CHES and health education requirements to that. So in the future, that's something that they would still be looking for because they saw the need and they filled it with me, which I'm very grateful for.
All right. Chesley kind of answered this already in one of the questions. So any other panelists, do you have any advice on getting experience with grant writing or just writing in general for health education roles?
I'll say at the state education agency, we have interns from a variety of our institution for higher education partners, and we always welcome them to author sections of grants. I work on a team where there are 10 of us, and 8 of us are 100% funded by some kind of grant. So we're always chasing some kind of funding. So it's a fantastic opportunity for the students to get that grant writing practice. So we welcome them to participate in grant writing.
Perfect. Yes. And Chesley had mentioned federally qualified health centers. And yeah, so I would absolutely recommend students kind of look at different practicum internship hours that you can do at higher ed institutions, qualified health centers, even local nonprofits. Would be great idea. Okay. Another question we had was how heavy of a role does evaluation play in kind of your everyday duties? Do you heavily lean into statistics, or can it be kept kind of light and basic?
I'm happy to address that one. So, there's some evaluation that's required by my funder, by SAMHSA. So some of that is required by the funder. But on top of that, I will say we do additional. We're undertaking a benefit cost analysis study that one of our institutions of higher ed is funding, to show the benefit of school behavioral health, and then be able to leverage that to try to get other foundations and funders to invest in our work. So there's the evaluation that's required by our funder, but then we've taken that one step further to truly show the value of our work.
Um, I'm going to combine two because we've kind of gotten this trend of like how do you stay current on trends and kind of current events. I'm going to combine this also with kind of the current political climate and federal budget cuts, and like how would you, or do you have any advice on staying, positive and kind of a checklist or any advice or skills on how we can kind of secure positions in public health or health education? And if not, again, would you consider career pivots or adjacent moves?
Who
Uh,
wants to tackle
yes,
that one?
yeah.
I'll start with one thing. So, you've heard a lot about Medicaid cuts, and we have really focused here in North Carolina on trying to maximize Medicaid cost recovery as it relates to school-based and school behavioral health services. Those are some services that are exempt from the cuts that you've been hearing about, but making sure that people have factual, accurate information about what the cuts are going to affect. There's a lot of information out there, and some of it is not correct. So making sure people really understand what the potential impact could be so they can plan appropriately.
And to piggyback to Dr. Austin's point, yes, it is truly, interesting times, and certainly folks who are being affected by, specifically Medicaid cuts. From what I understand, there are opportunities for healthcare organizations to create communications for those specific cuts. So, in my role here at the Cancer Center, my team is like, okay, so how are we going to message this from an oncology perspective? And just that process of saying, okay, how are we going to make sure that patients know how this is going to affect them, helps us with a little job security, right? So if we could be the person delivering the message, writing the message, that's helpful. So that's one area. And then, much of this information changes daily, weekly, monthly, and we don't really know until we know. And so part of it is like, well, do you wait and watch? But to your point, Taylor, a lot of people have considered pivoting their roles, like, flight attendant, maybe I should look at, maybe that's a weekend gig. We don't know. But I think it's important to, again, that flexibility. Obviously, I think people who go into this profession, you do it because you love it and it's going to be bumpy, but it can't hurt to sort of say, okay, if I didn't do this, what would that look like? Most of us are in the nonprofit sector or public sector. What does it look like from the private sector? Our colleagues that work for payers like, Anthem, Blue Cross Blue Shield, are they titling it the same thing? What are those conversations like? It's definitely a tumultuous time.
Chesley, before I kind of pivot to our last question, you kind of touched on it a little bit on that last one. We did have one question of what does CHES holders look like in the private sector? Because a bunch of us work in the nonprofit sector. So if you have any more you want to kind of expand on that private sector, please do.
Yeah. So I have colleagues when I say private sector, I'm going to kind of speak about insurers. So, there are many roles, and I think about our colleagues from the California. There's a person in the California area that sort of talked about that. They may not be called health education specialists, but this is what they do. So a lot of them are program managers. That title might be a little bit more, I think, open, but they certainly help with curriculum development, program planning, implementation. At least I'm in the Ohio space, so the folks do that there. And in some areas, they have sort of regions. So I'm in Northeast Ohio, but some program managers are responsible for this type of thing in different areas of my state or counties. So they certainly do that there. I work with some folks in the private sector in research who help to help with recruitment in terms of clinical trials and those types of things. And their background is not necessarily always like basic science. Some of them are public health folks. So seeing them there, I'm like, oh, what fantastic. And then, I've seen folks with health education degrees, health promotion degrees that work in pharma. So when we work with them for symposiums and meetings, just learning their background of what they do, and their training is in health promotion, health education, but they work, in the pharma industry.
Awesome. Did any of our panelists want to expand on that before we do our last question? No?
I'll add something. Obviously, being in the nonprofit, I don't have the private experience, but I will say, like when I was interviewing, I interviewed in all different roles. Like I interviewed in hospitals, I interviewed in schools, like I did all this stuff. And I really think it depends on how you advertise your skills. Not a lot of people are super familiar with the CHES certification if they aren't, like if they didn't have that as their background. So how are you explaining that I have this background in advocating and I have this background in leadership and implementation and ethics and all of that stuff? And that was really like a highlight when I got this job. They were like, we had never heard of that before, but like that's such a great certification. And it's just like so like wraparound comprehensive skills that you can serve any company with.
Yeah, I like to remind my college students it's your transferable and soft skills. And as a health education specialist, you wear many hats and have many skills, and it's very flexible. So, well, thank you all so much. So we're gonna wrap up with our one last question. So what? Sorry. And our last question is, in your opinion, what unique value or skill do certified health education specialists bring to your sector? So healthcare, community health, nonprofit. Antonio, I think we're going to start with you, if you don't mind.
Yes, so for me, in terms of in my sector, well, so there's a lot of different things. For me, is my ability to one thing I pride myself on is to remember names. So that's a skill I remember a lot of. So I do, like I said earlier, I do a food pantry line. So a lot of the community members, I remember their names. I've been doing this for 2 years now, so they do like that I remember their names. It seems to be so warm that they'll come, they don't tell me their name. They're always happy that they say, "Oh, you remember me? Thank you so much." And I hear that every time, or they'll come with a family member and they'll say to them, "Oh yes, he knows me. Listen, I don't even have to tell him my name. He remember my name," and they just walk past. So if my workmates, so when I'm not there, they complain. It's like, the line was slow because we don't know everyone's information like you do. So I think that is one thing, just the ability to remember. So works wonders to me.
Awesome. Madison?
Yeah, like I just said, the transferable skills for sure. We have so many skills in our backpack, so many tools that are needed in every single entity in every form. I also just think being the connector, like being the middleman, as time intensive as it is, like people recognize me, like I do onboarding and I do orientation. So they see me and they're like, oh, I remember her. I'm going to reach out to her for this question. And being able to be like, hey, I'm not super familiar on that. Let me get back to you. And like I said, closing the feedback loop, a lot of times if you send an email, never gets answered. So they're like, oh, well, my need was never met. So I guess it just doesn't matter. But being able to be like, okay, like you'll hear from this person or I'll reach out to them and get back to you on that.
Perfect. Thank you. Chesley?
I'm nodding, and Madison, you're so right, being that connector. I think that that's a huge component of what a CHES or an MCHES can bring to an organization, whether it's public or private. I often think that we're not necessarily the spoke of a wheel of all the things and the thing. Sometimes I think we're the hub because we can be that connector. So I love that. So I will add to that. And in at least in my space, health education specialists, they know the community. They are often from the community. So being able to share that story and advocate for what those needs are is huge, and doing that in a way that makes sense and can be articulated and helping those at least underserved areas is huge. So that's kind of the I think the added bonus. And everybody loves our chest pins, cool chest pins. Sometimes we wear. That's important.
Awesome. Thank you. Dr. Austin?
Yeah, so in the government space where collaboration across systems and with diverse stakeholders is key, I think MCHES professionals provide a strategic lens grounded in public health principles. We understand how to navigate policy, advocate for equity, and implement interventions that are both measurable and impactful. And these competencies are critical in shifting the focus from reactive responses to proactive, prevention-based approaches, and in my case, supporting student mental health and well-being.
Awesome. Thank you all so much for spending your time with us and geeking out over health education and CHES and MCHES and NCHEC. Jessica's going to hop back on and kind of wrap things up for us. And yeah, thank you all so much.
I think you're muted, Jessica.
You're muted, Jessica.
Sorry, I got too many screens going here. Anyway, just a quick wrap up. I wanted to remind everybody that to receive your continuing education credit, you'll need to complete the evaluation form that will be emailed to you within the next couple days. And also keep in mind that your CE credits will probably not show up on your CHES transcript or in your account until January. That's normal. That's the normal reporting period. We also encourage anyone to visit ncheck.org to learn more about upcoming events, professional development opportunities, follow us on social, and just learn some ways to get involved in the various NCHEC initiatives throughout the year and stay connected. And a reminder that if you are certified, please get on NCHEC Online. It's our community forum, and start some conversations and do some networking like we did here today. And I want to thank the panelists. You guys were awesome, and thank you for sharing your insights and your experiences and such practical advice. I loved seeing the energy and the questions in the chat. I mean, it was a great audience today too. So thank everyone for joining us and being a part of this ongoing event series, and also for continuing to uphold the standards of excellence that the CHES and MCHES credentials represent. Oh, and I did stick my email address in the chat. If you have any questions related to the webinar, you can always reach out to NCHEC staff members. Yeah, and that's about all I have, but thank you guys so much.